Thank you very much. Good afternoon, everyone. Governor, we welcome you to San Diego. We appreciate you being here at Alvarado, an incredible county partnership where we're working to expand our behavioral health services. I want to take a moment to recognize, you'll hear from him in a minute, Mayor Steinberg, 19 years ago, authored the original Mental Health Services Act, and has been incredible. Our legislative leaders, the President Pro Tem, Senator Atkins, and Assemblymember Ward, and other legislative leaders. And you know, everyone is here today. There is a great commitment to adhere to a belief that individuals struggling from behavioral health issues, mental health injury or illness or addiction, need to be afforded the same access to care and a quality life as anyone else is. We would never accept for a minute a system that said if you broke your leg and you need an appointment, that it would take 6 to 8 weeks for you to get an x-ray, a cast, and a set of crutches. But that's the system we have today for many individuals who are suffering from mental health injury or illness. We would never accept a system that would tell the diabetic, we're not going to give you a monitoring device and insulin and advice on the front end. We're going to wait until you go into diabetic shock. Call 911 and come to the emergency room, and at that point we'll help you, but only for that period of crisis. But that's the system that we have today, because we've inherited collectively a system that does not reimburse, staff, fund, cite issues of behavioral health in the same way. And that is the challenge that's in front of us. And with the governor's leadership and legislative support, that is the system we're trying to change, to make sure we can provide the right care to the right person at the right time, to give everyone an opportunity to confront whatever challenge or issue they face and live a sustained and whole life. But we also know that absent housing, no level of service will be effective. And so the efforts that are being proposed here today on the Mental Health Services Act, on the bond funding, on these things are vital and key and central to our ability to fulfill that basic human right of health care. And when I say health care, I mean health care including behavioral health issues. To the extent these things call for counties to do more, as a county supervisor, I'm here for it. Require counties to do what they need to do. Hold counties accountable. Make us be transparent. And if we don't do what we need to do, then penalize us. Because the days of allowing people to get there on their own are the days that need to be behind us. It is time to ensure that the folks who need the care and help, that it is available. And standing here at Alvarado, this is an incredible example of what can happen. Here we have our county government in partnership with our healthcare providers to say, how do we increase the availability of inpatient psychiatric beds? How do we increase the availability of crisis stabilization units? How do we provide outpatient treatment, care coordination, case management in one location? But this facility being expanded with government partnering with our healthcare providers allows us to take our existing psych hospital and transform that into subacute step-down bed capacity, something vitally needed. And then it allows us to take Third Avenue, another piece of the component, to build long-term residential care, to alleviate the burden on our hospitals that are bearing so much of the burden of individuals with nowhere else to go. But projects like these three together are not possible absent the dedicated funding, absent bond funding, absent the ability to move swiftly and quickly. And so I stand here today in full support of the governor's initiative and what they're proposing, and in recognition that we will have to do this and more to not just have the structure, to not just have the site, to make sure we have the staffing, to make sure we have the services. And so every day I'm encouraged at the direction we're heading, but we all have to remain incredibly impatient, that we have to go faster, we have to go bolder, we have to go quicker to get to that point where that individual suffering has the services that are available to them, and get out of the mindset of a crisis level of care. Well, we wait till you're in a state of crisis and then we stabilize you and then we discharge you right back to where you were and wait until you're in a state of crisis again. That's not good for that individual. It's not good for the taxpayers. It's not good for our family members and loved ones. And so that's the system that we're trying to change. And I'm honored to be here today and really tremendously appreciate, Governor, your long-term commitment. This is not the first time you've weighed in on one of these issues. It's not the first time you've been there to tackle issues of mental health and addiction and homelessness and housing. And we at the local level are incredibly grateful for it.